Health Canada approving 3 sites in downtown Toronto today, and this is one of them. Now, the 3 location advocates say will save lives just as the fentanyl overdose crisis takes more away.
I'm very pleased. Obviously, we're really happy that this happened. It's tinged a little bit with the fact that it took so long.
A decade of work, all leading to this. 3 supervised injection sites to be set up in Canada's largest city. Health Canada today giving the green light for what's being called life-saving services.
People will come in, they'll they'll be supervised, and there'll be medical personnel there, and there will be ability to arrest an overdose if it happens.
The hope is that these 3 centers will help stop an overdose crisis that's sweeping the city. Fentanyl is a powerful synthetic opioid that's similar to morphine, yet 50 to 100 times more potent. Dennis Long is an addictions counselor who sat on the city panel that pushed for the sites in Toronto.
People are dying at an extraordinary rate. There's been about a 500% increase in overdose deaths in the last 5 to 7 years. Like
the tragic death of Pierre Gregoire this February. A young man who died of an overdose in a KFC bathroom just steps away from the overcrowded homeless shelter he walked away from that evening.
We can't prevent every single death, but these sites will prevent many of them.
The sites will be set up in 3 downtown locations, one on Queen Street West near Bathurst, another at Yonge and Dundas, the final one on Queen Street East near Carlaw. All run from inside community centers already seeing high foot traffic from at-risk users. Councillor Joe Cressy says what's been remarkable in the planning is a lack of NIMBYism from residents.
The communities came out and said yes in our backyard. And one of the sites is in my community. And neighbors came out and said, drug use is already here. We already have a problem with finding needles in the community garden and in the playground. And it's going to help people, and it's also going to make our community safer.
The province announcing today that $3.5 million will now flow to the existing community health centers. The funding to go towards one-time renovations and operating costs.
The 3 sites are great. I mean, they're probably in the right place, but there needs to be a whole lot more.
The Mayor and Health Minister releasing a joint statement today applauding Health Canada's decision, and it's expected that these centers will be up and running in just a few months.